We are at the National District Hospital here in Bloemfontein, where investigations into the fire that started here is still ongoing. We've seen police officers as well as security personnel from the hospital still monitoring the situation in the building where the fire started. But I just want to bring in the spokesperson for the health department here in the province, Mondli Mvambi, to talk to us about what is the latest in terms of that investigation.
Well, the multidisciplinary teams were activated since last night in terms of the thorough ongoing investigation to make sure that we know what the source of the fire was. It is also for us, for future reference, to know what is it that we need to put in place systems to make sure that we protect patients' life limb and the equipment and the infrastructure of the hospital. We will hear when all the investigations are done. Already the MEC was here. He is already speaking to the Department of Public Works and Infrastructure just to make sure that they know what to do when the SAPS have finished their investigation. The Department of Labour has indicated what are the things that we need to be looking into so that the Department of Public Works and Infrastructure can then come in, and the department can also know what is the extent of the damage and the associated costs that need to be prepared to make sure that we do the repairs that are needed here.
We've seen earlier beds being moved from the building. Can you just talk to us firstly about which areas are affected in terms of services, and what should people then do when they come here?
Well, the entire hospital is affected in terms of services. There are no services being rendered here. We are making an appeal to all the people. Please don't come to National Hospital for services. Go to MUCPP, go to Pelonomi Polyclinic and the hospital itself, go to Universitas Academic Hospital up until further notice, because we have now made sure that the referral system of the department is not applicable at this point in time, so that people can have the services in all these areas. We have removed the staff that usually works here to augment the services in those other hospitals, so that there's no overburdening of the infrastructure or services in those hospitals. So it's up until further notice really that services will be provided. But you must know, people must know that we also provide eye care services here, which are not affected. Those who've got appointments for eye care services can still go. They'll be directed by the security at the gate. The oncology services are also provided here. Those are not affected, so people can still come to it. In terms of the beds that we moved here, remember yesterday when we were evacuating all the 83 patients, we also moved out the beds because they were being moved in those beds. Some of those beds were left here, and we are now taking care of those beds to make sure that they are moved to the new Gateway Clinic and the old Gateway Clinic, because it's equipment of the hospital that we still need to safeguard.
Thank you so much for your time. That was Mondli Mvambi there, the spokesperson for the health department here in the Free State, just talking to us about what is the latest in terms of the investigation, where they taking the staff that's supposed to be working here, and of course the distribution of the patients to other facilities around Mangaung. With that, it's back to you in studio.